Well, let me just first get your reaction to the cuts that we've seen from HHS and specifically at the FDA today.
Well, as I've commented on social media, I would say the FDA, as we've known it, is no longer exists. You've had almost all the leadership removed, all the civil servants, just several left, and a quarter to a third of the people who really make the place go in terms of operations and communications. And so it's a pretty big deal what's happened. And of course, all of us are waiting on the plans from the new commissioner and the new team. It's been no communication at all about what the plans are um, as this is happening.
Based on your conversations with your former coworkers, former employees, um, what's being hit the most within the FDA?
Well, first of all, let me just apologize for not being dressed up. I'm in my Duke basketball sweatshirt because just arrived down in California and I was not expecting to be on interviews. But let me just say that it seems like maybe there was an error made in thinking that if the reviewers for the medical products and the inspectors who actually do the inspections were um, not so many of them were fired, that would mean that everything else would work. There have been a lot of analogies people have made. It's sort of like saying if we have the railroad cars but no tracks or communication system for the railroad, that it's going to work. So it's really a very broad part of the FDA that's been taken out here. Almost everyone who does communication. So you're in communication. So what do we do when we find a safety problem in the food or with a drug or a device? There's a lot of expertise to get the message out in the right way that people can understand. It's just one of many examples. I would just say also, for we think about inspections, it's not like an inspector just gets up one day and shows up at a farm or a restaurant.
You were saying the communications has been hit hard, but it's sort of an across the board type cut.
Right. Just think about an inspector. An inspector doesn't just get up in the morning and go inspect a farm or a restaurant or a manufacturing plant. A lot of these inspections are overseas because a very large part of our drugs and devices are made in places like China and India and Europe. So it takes a whole team of people to get the information together to make sure the inspector knows what to look for. And then when the inspection report comes in, it's got to be put in the context of quality in the system. So it's a big team of people that have to work together. It's not just individuals doing their work.
You probably saw Secretary Kennedy's message last week when he announced these cuts, basically saying that, there's a lot of waste in HHS, and I assume he includes within FDA. What do you say to that? Is there waste in the agency, and what will this mean for some of the basic services that FDA provides?
Yeah, I think, as I've said on social media a number of times over the two stints I've had at the FDA, everyone who's worked in the federal government can think of a lot of ways that might be reorganized or made more efficient. It's a big organization, so it's far from perfect. But I think what they're going to find is that overall the FDA is actually underfunded. It's regulating 20% of the U.S. economy in fields that are rapidly expanding and getting more complicated and very globalized. And so, one way of thinking about it, the first time there's an outbreak of salmonella in the lettuce, they're going to hope they have some people there who know what they're looking at, not just um, digital technology or something like that. So while a lot of us, I've spent 6 years in Silicon Valley, so I'm in the crowd that thinks the FDA would be, and all of HHS would be greatly helped by AI and better digital technology, but you got to have the people. These are human issues that are very complicated.
Well, and you just had one of the people that was removed just days ago was the FDA vaccine chief, who well, Dr. Peter Marks. Um, you've heard what the secretary has said about vaccines. Uh, will vaccines, do you think, be approved in a timely manner, in an accurate manner under this newly formed FDA?
I'm really worried about it, and no one really knows. The secretary made some promises during his confirmation. Senator Cassidy was the deciding vote. He's a liver doctor. He's a hepatologist. He let it pass and said he thought he could um, keep in touch with the secretary and make things happen. But some of the moves that have already been made are extremely worrisome. We have a measles outbreak going on. Got the secretary recommending cod liver oil and vitamin A. There's not enough cod liver oil on the face of the earth to treat measles and prevent children from getting terribly sick and dying. And we had hundreds of thousands of people who died from COVID when they had a simple vaccine that would have made the difference. And we just finished one of our worst flu seasons in the last 30 years, where the flu vaccine that was available has now been shown to have reduced the risk of death and hospitalization by about 50%. So I don't, I'm very worried. There were promises made. It looks like they're not being kept. And there were also statements about radical transparency. We're not seeing much transparency on this. But, the new FDA commissioner has just been confirmed, and the same for the NIH director. So we got to give them a chance. They are going to be walking into a hard job.
What would be your message to the new FDA commissioner?
Get to know the people that work at FDA. I spent 35 years at Duke, therefore my Duke basketball jersey here. It's a great time for that. So I've worked in medical care. I've been an intensive care unit doctor. I've done medical administration, a lot of large-scale global research. I worked at Alphabet 6 years out in Silicon Valley. I've worked in every sector, and the people at FDA work as hard and are just as smart as anywhere that I've seen. And they're very dedicated to their jobs. So I really hope the new commissioner will take some time, get to know them, and then make the corrections. Make it, if you can think of ways to make it more efficient. I found in my time there the workforce resonated to being more efficient. That's what they want.
Two last quick questions. Obviously, the FDA, just one of a number of agencies that have suffered these cuts under HHS. Can you just talk about the communication between FDA, CDC, NIH, and are you worried that you're going to lose the communication between the different agencies in getting vaccines approved, in combating things like measles and bird flu?
Well, I'll give you credit. You sound like you're a pro because you picked on up on something that most reporters don't ask about. Let's just take the bird flu, which, has been on the top of the list for the next big pandemic for 20 years. And it's very close. All it's going to take is one mutation, and we're going to have another pandemic on our hands. That involves the FDA and multiple parts of FDA. We have the Center for Veterinary Medicine, we have the vaccine arena, we have the antiviral arena, but the Department of Agriculture regulates the cows and the chickens. And we got the CDC regulating the farm workers. And a lot of communication has to occur, including the White House, to coordinate it all. Because it probably doesn't surprise you to know in a state like North Carolina, where all these things are in play, what's best for the farm workers may not be best for the chickens, or what's best even for the chicken farmers may not be best for those that are raising cattle. And so you got to have communication. You got to have people who understand enough to make that happen. And it's a big worry. This makes it much more worrisome. Again, let's see the plan.
Lastly, and I don't want to raise the alarms too much, I guess, but you had the former head of the communications for the CDC he recently quit his job, wrote an editorial a week or two ago. I don't know if you saw it, but basically saying that he feels that there might need to be another form of health agency that sort of steps in here based on what he's seen about communication and based on what he's seen about issues of vaccines and things like that. Are you at that level of concern?
Well, what I just point out a couple of things quickly, if you can bear with me for just a minute. When the COVID pandemic hit, I was working at Alphabet, the parent company for Google. We had tremendous access to data from around the world that even the CDC didn't have. And there was a parallel effort that went on to help the CDC involving a number of academic medical centers and big tech companies that had capabilities. The CDC, in its best, has been handicapped by the rules we have in the US that every time we needed data from CDC, it has to get an agreement with each state individually, each tribal territory. And within states, there are several areas that are independent on their own. So now we've got a CDC which has got much less ability to put out data. And yes, there already is such a parallel effort underway just to provide up-to-date information to people so they can plan. It's if you're driving down the road and all of a sudden you can't see because something is on your windshield, you're going to stop and clean off the windshield so you can see where you're going. And we don't have the data about where the where the infections are, where the disease outbreaks are occurring. Um, we're really handicapped in terms of our effort to deal with it. So the short answer would be yes. The longer answer is it's got to be coordinated. We don't want to be competing with the public health agencies, but we want to make sure the public has the information that it needs.
Well, Doctor, really appreciate your insight. Is there anything else you wanted to add that I might have left out?
I would just stress that these are very unusual times for the public health system in the United States. We already have the worst life expectancy of any high-income country. I'm very worried it's going to go down, despite this Secretary of Health and Human Services coming in saying he was going to make America healthy again. And I'm 100% in favor of a better food environment. I want to be clear about that. It's very much needed. But we got to pay attention to all the areas of medicine and healthcare that keep people from dying or ending up in the hospital.